This medication is commonly used to treat arthritis of the knees. It helps to reduce pain, swelling, and joint stiffness, and improve your ability to move and flex the joint. Diclofenac, the active ingredient in Ziclocin 1.5 to 0.025% kit, cream and solution, is classified as a non-steroidal anti-inflammatory drug, NSAID. If you are dealing with a chronic condition like arthritis, it's important to consult with your doctor about non-drug treatments and alternative medications to manage your pain. Remember to always follow your doctor's instructions and ask for their guidance on the optimal dosage and timing for this medication. Before using Ziclocin 1.5 to 0.025% kit, cream and solution nonsteroidal anti-inflammatory agents, NSAID, topical, make sure to read the medication guide and the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. This medication is for use on the skin only. Apply this medication to clean, dry skin, as directed by your doctor, usually 40 drops for each knee 4 times daily. The dosage is based on your medical condition and response to treatment. Place 10 drops of this medication into the hand or directly onto the affected knee. Spread the medication evenly around the front, back, and sides of the knee. Repeat these steps until you have applied the prescribed dose to cover all surfaces of the knee. Let the medication dry for several minutes. Do not touch the treated knee, allow other people to touch it, or wear clothing over it until the treated knee is completely dry. Be sure to wash your hands before and after applying the medication. Avoid getting this medication in the eyes, nose, or mouth. Do not apply this medication to open wounds, or to infected or damaged skin. Do not bandage or tightly cover the treated area unless you are instructed to do so by your doctor. Wait at least 30 minutes after applying this medication before showering. It is important to use this medication regularly at evenly spaced intervals to get the most benefit from it. Use the exact dose prescribed by your doctor. Do not use it more often or for longer than prescribed. Do not use this medication for more than 3 months at a time unless directed by your doctor. For certain conditions, such as arthritis, it may take up to 2 weeks of using this drug regularly until you get the full benefit. If you are using this drug as needed, not on a regular schedule, remember that pain medications work best if they are used as the first signs of pain occur. If you wait until the pain has worsened, the medication may not work as well. Tell your doctor if your condition worsens. Some common side effects of Ziclocin 1.5 to 0.025% kit, cream and solution nonsteroidal anti-inflammatory agents, NSAID, topical include skin irritation, drowsiness, or dizziness. If any of these effects persist or worsen, consult your doctor. It's important to note that this medication has been prescribed because your doctor has determined that the benefit to you outweighs the risk of potential side effects. However, this medication may raise your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if it becomes elevated. Serious side effects may include signs of kidney problems, symptoms of heart failure, or symptoms of liver damage. If you experience any of these serious side effects, seek medical attention immediately. Additionally, while rare, a serious allergic reaction to this drug is possible. If you notice any symptoms of a serious allergic reaction, such as fever, rash, or difficulty breathing, seek immediate medical help. It's important to remember that this is not a complete list of possible side effects, so if you experience any other effects not listed, consult your doctor or pharmacist. Non-steroidal anti-inflammatory drugs, like Diclofenac, may increase the risk for a heart attack or stroke, especially if used for a long time. This risk may be greater for older adults or those with heart disease, high blood pressure, or diabetes. Do not use this drug before or after heart bypass surgery. This drug may also cause serious bleeding from the stomach or intestines, especially in older adults. Stop using Diclofenac and seek medical help if you experience stomach pain, black/bloody stools, or vomit that looks like coffee grounds. Talk to your doctor or pharmacist about the benefits and risks of using this medication. Before using Ziclocin 1.5 to 0.025% kit, cream and solution nonsteroidal anti-inflammatory agents, NSAID, topical, make sure to inform your doctor or pharmacist about any allergies you may have, as well as any other medications you are currently taking. It's important to also discuss your medical history, especially if you have asthma, liver disease, heart disease, high blood pressure, or kidney problems. Using this medication may increase the risk of kidney problems, especially if you are dehydrated, have heart failure or kidney disease, or are an older adult. It's important to stay hydrated and notify your doctor if you experience any changes in your urine output. Be cautious when consuming alcohol or using marijuana while taking this medication, as they may increase dizziness or drowsiness. It's best to avoid driving or operating machinery if you experience these side effects. This medication may also increase the risk of stomach bleeding, especially when combined with daily alcohol and tobacco use. It's important to limit alcohol intake and stop smoking while using this medication. Additionally, this medication may make the treated area more sensitive to the sun, so it's best to limit sun exposure, avoid tanning booths and sun lamps, and wear protective clothing. Consult your doctor about using sunscreen while using this medication. Before undergoing surgery, be sure to inform your doctor or dentist about all the medications you are using. For women of childbearing age, it's crucial to discuss the benefits and risks of using this medication with your doctor. If you are pregnant or planning to become pregnant, notify your doctor, as this medication may harm an unborn baby and cause complications during labor and delivery. It is not recommended for use in pregnancy from 20 weeks until delivery, and if necessary between 20 and 30 weeks, the lowest effective dose should be used for the shortest possible time. It's also important to consult your doctor before breastfeeding while using this medication. When using Ziclocin 1.5% to 0.025% kit, cream and solution, it's important to be aware of potential interactions with other medications. This can affect how well the medication works and increase the risk of side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medications without consulting your doctor. There are some medications that may interact with Ziclocin 1.5% to 0.025%, including aliskiren, ACE inhibitors, angiotensin II receptor blockers, corticosteroids, lithium, methotrexate, and certain water pills. Additionally, this medication may increase the risk of bleeding when used with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. It's important to carefully check the labels of all prescription and non-prescription medications, as many of them contain pain relievers/fever reducers that are similar to Diclofenac and may increase the risk of side effects if taken together. However, if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless instructed otherwise. Always consult your doctor or pharmacist for more details. When using Ziclocin 1.5% to 0.025%, be mindful of potential interactions with other medications, and always check with your doctor or pharmacist before making any changes. Rephrased, if this medication is accidentally ingested, it can be harmful. If an overdose occurs and serious symptoms such as passing out or difficulty breathing are present, call 911 immediately. Otherwise, contact a poison control center. In the U.S., residents can call 1-800-222-1222, while in Canada, contact a provincial poison control center. Symptoms of an overdose may include severe stomach pain, changes in urine output, and slow or shallow breathing. It's important not to share this medication with others. You may need to undergo lab or medical tests, such as blood pressure, complete blood count, or liver and kidney function tests while using this medication. Make sure to keep all your medical and lab appointments and consult your doctor for more details. In addition to using this medication, lifestyle changes such as weight loss if needed, and strengthening or conditioning exercises may help improve your flexibility and joint function. It's best to consult your doctor for specific instructions tailored to your individual needs. If you happen to forget a dose, simply use it as soon as you remember. However, if it's almost time for your next dose, then just skip the missed one. Make sure to continue with your regular dosing schedule and do not take a double dose to make up for the missed one. It's important to store Ziclocin 1.5% to 0.025% kit, cream and solution nonsteroidal anti-inflammatory agents, NSAID, topical at room temperature. Be sure to keep all medications out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless specifically instructed. When the product is expired or no longer needed, it's important to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.